Gonna try it again. So Friday we had difficulties, and actually all weekend with AT&T, and so routers going down, in and out, etc., etc. So hopefully AT&T will stay with me because I got cut off about halfway through Friday morning when we were talking about resveratrol. And once again, with my Missouri accent, I tend to trip over that word. It's not resveratrol, it's resveratrol. Um, and so the point of discussing this is we've all heard for several years, Highlander, several years, that red wine is good for you. We'll touch on that. Grape juice has the same thing, so same thing in it. Hey Dana. So resveratrol really is here's the chemistry lesson. So it's a member of a class of polyphenols called stilbenes. That's it. That's the whole chemistry. I'm not going to go through all the different cis and trans configurations, etc., etc. It is carried on bound to a glucose molecule. So that makes it a glucoside, and that's one of the reasons that it has some benefits for type 2 diabetes and blood sugar control. All right, so in the early 1990s, the presence of resveratrol was confirmed in red wine, so it was established by the scientific community, who then started exploring what that would do for your health. So it was kind of postulated, hypothesized, that resveratrol intake via moderate red wine consumption might explain the fact that people in France have a relatively low incidence of coronary heart disease despite consuming foods that are high in saturated fat. So all over Europe, specifically France, wine is served with dinner, lunch, whatever. I spent 6 weeks in Europe when I was 16, and every meal we either had beer or wine. No water, no milk, no soda pop. It was beer or wine. They call that the French paradox. So in other words, why do French people, why do people in France, despite eating all this high saturated fat food, have a lower incidence of coronary heart disease than we do? Well, for me, that's because high-fat foods doesn't really do that. It's more sugar. And you've heard me talk and gripe about sugar for several months now. So the problem we have with coronary heart disease in this country is probably still 25% smoking, and then too much carbohydrate in our diets. Supposedly, and I haven't looked this up yet, the government, the expert committee on the government guidelines for food intake in the U.S. came out with a new report. It was due anyway in June, and we'll talk about this maybe at another video. But it'll be interesting to see if they realize that low carbohydrate diets have so much science behind them since they redid those guidelines in 2015. So here we are 5 years later. There are more government guidelines coming out. So it'll be interesting to see how they state that. I haven't seen it, but I'll look for it. Okay, so if you take resveratrol, and they've done scientific studies on people drinking single oral doses of 25 milligrams of resveratrol, and they get a peak in the metabolites around 60 minutes later. And that was whether or not the resveratrol was administered in wine or vegetable juice or grape juice. So all three of those, 25 milligrams of resveratrol, and you get a peak metabolite concentration 60 minutes later. Okay, if you give half a gram, 1 gram, 2.5 grams, 5 grams to healthy subjects, you get unmetabolized resveratrol peaking between 0.8 and 1.5 hours later. And then up to 5 grams a day of resveratrol for a month, 29 days, significantly greater peak plasma concentration of the trans-resveratrol uh, chemical structure, and then some glucose conjugates as well. Even 1 gram a day, which is less likely to cause side effects. 5 grams a day would be a huge amount. You still got pretty good maximal concentrations of resveratrol at 1 gram a day. Okay, so what does it do? Well, I can run through all the things it does real quick, or I can take my time and kind of explain to you. Hopefully AT&T stays on. So really, it's been primarily investigated in tubes and animal culture cells, and of course the poor rats. So there's not a whole lot, again, there's not a whole lot of, once again, human trials, because you cannot patent a natural substance. Okay, so think if the FDA was, well, I mean, the FDA, I guess, looks at wine and grape juice and food and all that stuff, but you can't patent resveratrol. Okay, so it has a direct antioxidant activity. So I'm going to tell you this, and then I'm going to give you the 7 health benefits of resveratrol, which is going to sound like I'm saying the same thing, but that's how I teach. Again, I'm going to tell you what I'm going to tell you, and then I'm going to tell you, and then tell you what I told you. So really, in a test tube, so you got to remember, most of these studies are done not on people, they're done on test tubes and animal models and cultured cells. Okay, resveratrol scavenges or neutralizes free radicals and other oxidative stress molecules, specifically reactive oxygen species, and it tends to lower the oxidation of low-density lipoprotein, that little cholesterol taxi that everybody calls the bad cholesterol. Well, it's not really that bad, it's just a taxi, but if you oxidize it, that's the first start toward plaque formation after you've had oxidative stress to the inner lining of your arteries, specifically your coronaries. And it does that, resveratrol, by inducing antioxidant enzymes. And the one that you would maybe have heard of is called superoxide dismutase. There's a whole bunch of other stuff. And it inhibits reactive oxygen species, which can be made from just mitochondrial processes. So we've talked a lot about the little engine in your cell called mitochondria that produces adenosine triphosphate, which is the energy needed for reactions that aren't simple. So they need an energy source, and ATP is the energy source. And we talked, when we were talking about NAD plus last week, that resveratrol is a plant compound that's found in red wine and grapes, peanuts as well, activates sirtuins. And the sirtuins are proteins that defend the mitochondria from oxidative stress damage. So the mitochondria is doing these little reactions and creating reactive oxygen species and free radicals. And if you don't have enough NAD and resveratrol, then damage to the mitochondria follows, and eventually the ability for the mitochondria to do for the cell what it needs to do is significantly not reversed, but I guess slowed down. And remember, mitochondria has its own DNA. It comes from your mother. And when a cell is damaged beyond repair, the mitochondria is what directs the cell to commit suicide. That's apoptosis, more common as you get older. So a lot of anti-aging strategies and medical intervention is designed to decrease apoptosis. And resveratrol, NAD, and the sirtuins, glutathione, vitamin C, vitamin E, all of those immune boosting things and supplements, and those that reduce the amount of oxidative stress on cells is kind of the whole point of supplemental therapy to reduce aging, or the effects of aging. Okay, so the sirtuins protect and actually repair the mitochondria, but they have to be turned on by resveratrol, and resveratrol cannot do that without enough NAD in your cell. Once it's reduced, So NAD can be reduced to a phosphate oxidase or oxide, and it's appropriately called NOx, N-O-X. So an oxidized NAD is a product of oxidative stress. So resveratrol and sirtuins are there to help reduce the amount of damage to the mitochondria. So that's the antioxidant property. It is not as effective or strong, I guess, as vitamin C and vitamin E, and then the big one, glutathione, which we talked about almost a week and a half ago, about glutathione injections. So glutathione is majorly important, but they all work together: glutathione, NAD, resveratrol. Okay, resveratrol also has estrogenic and anti-estrogenic activity. So it can act like an estrogen in certain instances, and it can block estrogen receptors in other instances. So the hormone estrogen, or the three types of estrogen, so there's estradiol from the ovary, estrone from peripheral body fat, and estriol, which is made in the placenta during pregnancy. Those three estrogens bind to estrogen receptors for cells, and then interacts with a unique sequence in DNA to modulate the expression, or to change, or hopefully make it better expression of those genes. So the chemical structure of resveratrol very similar to the synthetic estrogen agonist diethylstilbestrol. We talked about that Friday, I think before I got cut off. So diethylstilbestrol, DES, is what you heard as, can be used for some medical good, but DES was used in pregnancy in Europe to prevent miscarriage, and DES was found to be a teratogen for unborn babies. So there was a big group of babies born with fibromyalgia, where they had hands and feet but no legs and arms. So the hands would come out of the shoulders, the feet would come out of the hips. That's fibromyalgia. The FDA kind of hangs their hat on the fact that they blocked DES from being FDA approved for that indication in the United States. So every time you fault the FDA, they're going to tell you about DES every time. I've heard it for years and years and years. Well, we kept DES out of the U.S. Okay, that's fair. But more recently, so that's a DES thing. So resveratrol can act as either an estrogen-like or DES-like agonist, means it stimulates the receptor, or an estrogen antagonist, so it blocks the receptor. More recently, resveratrol was shown to improve lining of the blood cell wound healing due to its effects on inflammation. So it modulates inflammation during trauma, during arterial injury. Okay, the other one that we kind of touched on, and I think I touched on this after AT&T threw me off, was anti-cancer biologic activities and cancer prevention activities of resveratrol. Okay, so there are some compounds that don't become carcinogenic or cancer-causing until they've been metabolized in the body, and this involves cytochrome P450 enzymes. So resveratrol can induce and change cytochrome P450 in the liver, which is what clears pharmaceutical meds. So there is an interaction. So that's one of the people that detract about resveratrol, is it can alter blood levels of pharmaceutical medications. My viewpoint is, well, let's get you healthy so you don't need pharmaceutical medications, then you don't have to worry about it, right? So resveratrol might help prevent cancer by limiting the activity of metabolites that are pro-carcinogens. In other words, they can turn into carcinogens and become toxic and toxic chemicals, okay? It also inhibits, resveratrol, proliferation and induction of apoptosis through that mechanism we talked about earlier. Okay, so if DNA is damaged and the mitochondria is damaged, eventually you can have pathways that lead to cell death directed by the mitochondria if the damage is irreparable. Okay, and then that creates mutations that can contribute to the development of cancer. And then cancer cells proliferate rapidly. They just take over. Um, they take over a cell and keep a cell from responding to that cell death signal that initiates apoptosis. So a damaged cell, your body is set up to destroy that cell by suicide, basically. And cancer cells can inhibit that, so just take over the cell and just keep growing and proliferate. So resveratrol has been found to induce cell cycle arrest and or programmed cell death in a number of cell lines reviewed. Okay, so once again, on the cancer front, you can have good stuff from resveratrol. You may have some bad stuff from resveratrol. So if resveratrol inhibits apoptosis and it's a cancer cell, then theoretically the cancer would be continuing to proliferate. But if you're taking resveratrol and the sirtuins repair the damage to the cell and arrest apoptosis on a good cell, then you're in better shape, right? Okay, also tends to inhibit tumor invasion. Okay, so cancer cells invade normal tissue aided by enzymes, and resveratrol inhibits the activity of at least one type of enzyme that allows that. And then the anti-inflammatory effects. So cancer is an inflammatory process. Would have to be in order to take over a cell, right? So inflammation promotes cell proliferation or turnover, and then new blood vessels, or what's called angiogenesis. So angiogenesis. So one of the ways that you can check women for breast cancer who don't like the radiation of mammography, or who just they hate mammography. I've heard women say, well, if I want a mammogram, I'll just go out to the garage and slam the garage door on my breast. It feels the same way. So you can do a thermogram. Just recommended one of these two weeks ago. Thermogram that looks for hot spots, and that's looking for angiogenesis, so new blood vessel growth. So if you have a hot spot, there's inflammation involved, and sometimes that's a cancer. That tells you on the thermogram, without any radiation or slamming the garage door on the breast, whether or not you need to look closer at an area of the breast. And actually, you can do a thermogram of your whole body and show the hot spots will show where you have inflammation. Okay. So let's talk about, since we're about 16 minutes into this, 7 health benefits of resveratrol. A lot of the information I just gave you is from a review paper from Tehran, Iran. So a lot of Middle East medical stuff never makes it over here, but they have fascinating stuff. That's where I found all the research that had been done on black cumin seed oil. It's all done in the Middle East. And then the other part that I was talking about was from the Linus Pauling Institute in Oregon. So the vitamin C guy. Okay, so 7 health benefits. What is it? Again, it's a plant compound. It's an antioxidant. Berries, peanuts, red wine, and grapes. The compound in grapes tends to be in grape skin, so that's why, and they take the skin off grapes to make rosé and white wine. So red wine seems to be the thing for resveratrol. Okay? Once again, most of the information that we get is from animals and test tubes, limited human research. So, number 1 of 7, resveratrol supplements may lower your blood pressure because of their antioxidant properties. So they have it's kind of a promising thing for lowering blood pressure. I'm not going to say that's everything, because blood pressure can be so convoluted. But in 2015, they actually showed that the pressure exerted on our artery walls decreased with people taking resveratrol. So decreasing when the heart beats, that's systolic blood pressure, which is the upper number in blood pressure readings. Should be 120 or less. Hypertension, systolic hypertension is 140 or higher. kind of rampant in the U.S. You know, it's the silent killer. Blood pressure can get you, and you don't really feel anything from that. Okay, so typically as you get older, especially by the time you're 60, your systolic blood pressure usually goes up. Your arteries stiffen in response to that higher pressure. And if it stays high, that's a risk factor for heart disease by and of itself. So resveratrol appears to produce more nitric oxide, and we talked about that in class 2 months ago. Nitric oxide is produced in the cell lining of arteries, and it reduces blood pressure. It causes blood vessels to relax. It's also involved in erectile dysfunction. So men that have ED usually have reduced blood flow to the penis. Viagra helps improve nitric oxide. So does Cialis, and the other one I can't think of, Levitra, yeah. Improves nitric oxide so that blood vessels in the penis relax, blood comes in, you get an erection. So nitric oxide is kind of a big deal. Resveratrol helps improve production. Number 2, there's a positive effect on blood fats with resveratrol. This is animal studies. So 2016, the poor mice, high protein, high polyunsaturated fat diet with resveratrol supplements. The average total cholesterol level and body weight of the mice decreased, and their HDL, the good cholesterol taxi, increased. So it seems to influence cholesterol by an effect on an enzyme that controls cholesterol production. Remember, that's from the liver. And it also decreases oxidation of the bad, quote, LDL cholesterol by inhibiting oxidation, which contributes to the plaque buildup in artery walls, which only starts when you get cracks inside the lining of the artery from oxidative stress. So, grape extract. So this is a human study. Grape extract that it had a boosted amount of resveratrol. 6 months of treatment, LDL had gone down 4.5%. Oxidized LDL, the yucky one, down by 20% compared to unenriched grape extract or a placebo. So a placebo-controlled study, double-blinded. Number 3, it tends to lengthen lifespan in certain animals. Okay, so this is a huge amount of research looking at whether or not resveratrol can help you live longer. Well, I've told you several ways to do it. One is take your vitamin D, and 2, take your zinc to avoid coronavirus, and take your vitamin C. So there's evidence that resveratrol activates genes that ward off the disease of aging, probably from the apoptosis inhibition, but also seems to do the same thing as caloric restriction. And for years, this is why I want to read this government food guideline. Caloric restriction, intermittent fasting, and reducing carbohydrates has shown to lengthen lifespans for quite a few years actually now. And that has to do probably with how the aging genes express themselves. So resveratrol is a way to potentially improve the expression or reduce the expression of genes that makes you age. So in the animal studies, the increase in lifespan from resveratrol was 60%. Okay? Unfortunately, the animals that had the best lengthening of their lifespan were not related to humans. So we're talking about like worms and fish and all that, so nothing even close to humans. But it has kind of the same effect as intermittent fasting, carbohydrate reduction, and less calorie intake. That'll lengthen your life. Number 4, it'll protect your brain. So drinking red wine slows down age-related cognitive decline. So Alzheimer's, probably from antioxidant effects and the anti-inflammatory activity. So Alzheimer's disease is involved with formation of amyloid plaques, which come from protein fragments called beta amyloids, and that eventually shrinks your brain. So your cognitive decline. Boy, that Missouri accent. cognitive decline, I still can't say it, sets off a chain of events that damages the brain, and resveratrol, through that antioxidant, anti-inflammatory activity, slows down that chain of events. Okay, so still, it's the metabolism. So resveratrol can be quickly eliminated. So it's kind of one of those things where if you're going to do it, you just got to keep taking it because your body's going to metabolize it reasonably fast. So it's a daily thing. Number 5, it may increase insulin sensitivity. Okay, so you want your insulin to work on your glucose. If you feed your body too much carbohydrate, eventually your body becomes resistant to insulin, and it won't control your glucose, and that's called insulin resistance. And eventually that turns into type 2 diabetes. 100 million Americans have insulin resistant issues. Okay, so resveratrol increases insulin sensitivity. It tends to prevent complications of diabetes, and remember, that's blindness, cardiovascular disease, stroke, all kinds of icky things that you don't think of. I mean, diabetes, complications of diabetes by itself is the 7th leading cause of death in the U.S. And basically, resveratrol stops an enzyme from turning glucose into sorbitol, which is a sugar alcohol, and that builds up in people with diabetes and creates cell-damaging oxidative stress. So the real basic problem with diabetes is oxidative stress, reactive oxygen species, and free radicals. Okay, so helping with decreasing inflammation, preventing protein stress. And then there is, and we might do a whole class on adenosine monophosphate protein kinase, or AMPK. It's a protein that helps the body metabolize glucose, and if it's activated, it helps keep blood sugar low, and resveratrol activates that enzyme. Okay, so if you don't have diabetes, resveratrol provides even more benefits. Okay, so you get actually more antioxidant and anti-inflammatory activity if you don't have type 2 diabetes or insulin resistance. But again, we're talking about 1/3 of the country. Number 6, may ease joint pain. Okay, so arthralgia is pain in the joint. Arthritis or osteoarthritis, that bone on bone, you've lost your collagen and cartilage in your joints, leads to joint pain, loss of mobility. We're not talking about rheumatoid arthritis, that's an autoimmune disease. Okay, so they're looking really closely at plant-based supplements, resveratrol being one of them, as a way to treat and prevent joint pain. And so it may be that resveratrol, what they're thinking is that it may protect cartilage from deteriorating, which is what leads to osteoarthritis and bone on bone, and then you get new steel knees and hips, et cetera, et cetera. And so cartilage breakdown, because of the bone on bone, causes joint pain. Okay, so now here's the poor rabbits. If you inject resveratrol in the knee joints of rabbits that have arthritis, those rabbits have less damage to their cartilage. Now, building it back up is another story. That's platelet-rich plasma and stem cells. Okay, so reduction in inflammation and preventing breakdown of cartilage, resveratrol. Number 7, resveratrol, as we discussed, may suppress cancer cells, so inhibits cancer cell growth, so inhibits replication and spreading. Okay, it's been shown to fight several types of cancer cells: gastric, so stomach, colon, skin, breast, and prostate. Okay, it does that by inhibiting cell growth. It inhibits or changes the gene expression to inhibit growth of cancer, because remember, cancer takes over your DNA. It can have some hormone effects. So theoretically, if you have an estrogenic tumor, like breast cancer, or ovarian cancer, or uterine cancer, also endometrial cancer, known as that, it could typically stimulate, or could potentially stimulate those. So that's why there's some cancer propagating and some cancer inhibition with resveratrol. And I think I talked about this after AT&T threw me off last week. The HeLa cell line is from cervical cancer. Um, the HeLa cell line comes from one woman back in, I think, the 50s. Henrietta Lack is her name. I can say that because they wrote a book about her. The HeLa cell line is still alive from that woman's cervical cancer. She was never she never was paid anything for that cell line. They're still studying it, and it turns out they did a cell culture line of HeLa cells, and resveratrol inhibited cervical cancer in her cell line. So that's kind of like the cell line on which all cervical cancer treatment has been based in the last 70 years. Okay, what's the risks and concerns? Well, not really any concerns as far as side effects. Although if you took that 5 grams a day, you probably would. But there's not enough conclusive recommendations about what dose a human being needs because there's not that much human research. So you could buy a supplement and just do what it says on the bottle, but remember they're sort of guessing. So it's kind of what can people tolerate? Probably not 5 grams, but a gram is pretty well tolerated without any side effects at all. So, healthy people seem to tolerate them well. The precautions are reactions within other medications through the cytochrome P450 system enzyme, which helps you clear pharmaceutical meds once they've done their thing. They also tend to stop blood clotting, so they inhibit platelets. So if you're on clopidogrel, Plavix, or if you're on heparin, Coumadin, even an aspirin a day, resveratrol, could potentially make the bleeding time even longer. So it does tend to inhibit platelet aggregation. Okay. The medication line that usually resveratrol interacts with is certain blood pressure medications, anxiety medications, and immunosuppressants. So if you're suppressing, like a person that's had a liver transplant on an immunosuppressant, the liver is the cytochrome P450 system, they probably don't need to be on resveratrol. As usual, you check with a doctor if you want to do this, or a health coach like me. So it's a not well human studied supplement, but it has some pretty good potential. So what we'll do is end here. I think I got through it without getting booted off. So that's good. I'll be at the Lake of the Ozarks Wednesday. I think I'm going to do something on the coronavirus with a different background for you, but I'll have to use my phone. There's no Wi-Fi down at the lake, at least at the lake house. And so what we'll do is Wednesday morning, I've got some thoughts on coronavirus. Things are changing a little bit, and I'll tell you what's going on. More so than, it's ramped up in Houston and Florida and all these other places. We'll talk about what you can do, again, to protect yourself and some stuff that will, if you intervene early, that potentially could keep you out of trouble. Okay, so thanks for listening. It's 10:04. I did it in 33 minutes. Yay. So I'll talk to you Wednesday from the lake. Peace and health. Happy birthday, Eileen, if you're on here. There's 2 Eileens, actually, that kind of join in here. And both of them have birthdays today. So I'll see you Wednesday. Peace and health to all of you. Thanks for listening. See you later. Bye.